Nursing diagnosis, ineffective protection related to ventilator dependency, secondary to mechanical ventilation, as evidenced by dyspnea, ineffective cough, restlessness, decreased tidal volume, changes in respiratory rate, and emesis. Desired outcome, the patient will be free of or have a decreased risk of injury, as evidenced by proper ventilation settings and the absence of ventilator-associated pneumonia. Intervention. Assess the ventilator settings routinely and alert the respiratory unit of any discrepancies immediately. Rationale. Regular evaluation of the ventilator ensures that the patient receives the appropriate mode, rate, positive end respiratory pressure, flow rate, tidal volume, and pressure support. Ensure that the alarms on the ventilator are activated, as they warn the caregiver of any ventilation difficulties. A prompt response to an alarm ensures that corrective actions are taken and enough ventilation is maintained. Intervention. Assess any alterations in the patient's level of consciousness. Rationale. Disorientation, restlessness, and agitation are among the first symptoms of hypoxia. Late indications include fatigue, lethargy, and drowsiness. Intervention. Assess the patient for any indications of pulmonary infection, fever, purulent secretions, cough, dyspnea, and rhonchi. Obtain samples for bacterial cultures and review white blood cell counts. Rationale. Patients using ventilators are at increased risk of developing ventilator-associated pneumonia. It also increases the mortality rate and the risk of infections caused by gram-negative bacilli. Intervention. Evaluate the patient's respiratory status, i.e., respiratory rate, work of breathing, and rhythm. Rationale. Regular evaluation ensures early diagnosis of changes in respiratory status. Intervention. Monitor for the presence of barotrauma and plateau pressures. Rationale. Barotrauma is a typical manifestation of pulmonary tissue damage resulting from pressure differences between an internal, unventilated compartment and an external gas or fluid. Increased plateau pressures also enhance the likelihood and incidence of barotrauma in patients undergoing mechanical ventilation. Intervention. Elevate the head of the bed to 30 to 45 degrees and allow subglottic secretion drainage unless contraindicated. Rationale. Raising the head of the bed improves lung expansion. Meanwhile, subglottic suctioning eliminates stagnant secretions and minimizes stomach reflux and aspiration. Intervention. Promote oral hygiene and recommend brushing the teeth with a soft bristle toothbrush at least 2 to 3 times a day. Rationale. Oral hygiene reduces colonization of bacterial flora, particularly respiratory pathogens, that could be aspirated. Intervention. Institute interventions to prevent ventilator-associated pneumonia. Rationale. Prevents nosocomial pneumonia. Nursing diagnosis, ineffective protection related to bone marrow suppression from chemotherapy, secondary to osteosarcoma, as evidenced by thrombocytopenia, hematoma, anemia, amputation, itching and irritation in the stump, and oral discomfort. Desired outcome, the patient will not experience any bleeding episodes, and their fever will remain below 37 degrees Celsius. Intervention. Assess the patient for any profuse bleeding and monitor for febrile episodes. Review laboratory findings, platelet count, hematocrit, absolute neutrophil, and white blood cell count. Rationale. Active bleeding results in significant decreases in blood profile, necessitating immediate intervention. Intervention. Check the patient's dressings for any bleeding and evaluate the stump for redness, drainage, or pain every 2 to 4 hours. Offer routine stump care and cleanse the area thoroughly while rewrapping the site with an elastic bandage. Rationale. The presence of bleeding and pain can indicate infection or risk of bleeding at the amputation site. Intervention. Assist patients with self-care and promote as much independence as possible in conducting activities of daily living, ADL. Rationale. Self-care tasks such as eating, oral hygiene, and bathing may boost a patient's activity level, blood circulation, and muscle strength. It also encourages independence and increases their control over daily personal care needs without causing discomfort or joint damage. Visit nursestudy.net for over 1,000 free nursing care plans and nursing exams.